Welcome to Healthline 3. I'm Terri Simmons. Today we're talking with Dr. Chatrath of Bossier Orthopedics about joint replacement surgery. We'll be taking your calls throughout the show, and as a reminder, please make sure you're in a quiet room with your TV turned down to a low volume when you call in so we can be sure and hear your questions. The number to call is 318-219-4569, and you'll see it across the bottom of your screen throughout the show. So, Doctor, thank you so much for being here with us today.
Thank you so much for having me. I really appreciate it.
We are so excited. We appreciate having you here because we want to talk about joint replacement surgery. And we're already finding out with our discussions earlier, you and I've already found out so much. So it's lovely to share all the different myths that we can talk about that people think it's just wear and tear. But that's not always the case. So first of all, tell us what you do as this type of surgeon.
So joint replacement surgery is really focused on people who have exhausted other options. Their joints have wore out and they've tried simple things. These simple things can vary from over-the-counter medication, bracing, physical therapy, exercise, weight loss, and they're to a point where the joint just does not respond to any of these measures. That's the part where we jump in and offer them a joint replacement. So the part which is wore out, we actually really should not even call it a joint replacement. It's kind of a misnomer which has stuck throughout the decades. It's more of a joint capping. Okay, it's funny you say that because sometimes people come and they're like, "Are you going to cut out my joint?" I'm like, "No, we're not going to do that."
Yeah, it does sound like that. A joint replacement, like you're replacing it with something, and that's not the case. So I'm so glad you're here to just explain exactly what it means when you work on the joints.
Right. So as I was saying, it's like more capping a joint. So we replace the worn end. So the best way to think about it is think of your car. You're driving a car, the treads on your car wear out, okay? You're not going to throw the rim away, right? You're going to put new treads on it. So you're just like recapping the whole thing, and you get extra X thousand miles on it. So that's basically what we do. Now, over the years, with all the experience that we've gained from my predecessors, professors, the procedure has been so refined that this procedure is now done outpatient. You come and go home in a few hours. Not exactly like getting a pedicure, but we're kind of getting there.
That's a nice way to think about it, though. That's nice, pleasurable. It's that's a really good way to put it when we talk about it, how often you do it, how proficient, how this has come a long way, and it really takes all of the fear out of it because it can really be scary. A joint, because what all joints do you work on? Is it every shoulder, everything?
Most of the work I do is hip, knee, and shoulder replacements. And that's what I specialize in. I spent extra years training when I was in training. That seems like a long time ago now, but I spent extra time specializing in shoulder, hip, and knee replacements. And these big joints are the ones which really affect our mobility. The other joints, obviously, like if you get arthritis in your hands, that can be pretty debilitating. But for majority of the common population that we see, it's the hip, knee, and shoulder which tends to be the major problem. And that's what we offer joint replacement surgery on.
Okay, and you talked about a lot of obviously weight bearing maybe can be a factor, and I'm sure. Okay. Oh, we have a caller already, so I'll save my question for later. Sure. Tara, what is your question for the doctor?
I think my question's in line with yours. I was wondering if running marathons or jogging or lifting weights or powerlifting contribute to joint, degradation or injury, or does it help the joint?
Tara, great question. This is something, you know, when I actually was in my early stages of training, I used to wonder a lot. There have actually been good studies which show that running a marathon actually does not affect your joint. Now, if you have an injury, I've also met ego runners who will just not stop. And if you have an injury, take the appropriate precaution, recover, and get back to it. Don't hurt yourself. Again, in the gym, it's called ego lifting, and I like going to the gym, so you just have to control what's good for your body. But certainly, weightlifting, jogging, exercise would not harm your body. There are now conclusive studies which show that. I hope that answers that.
Yes, it does, and I appreciate your answer because I'm 60 years old, and I do both of those things, and I'm not stopping.
You keep going. We're rooting for you.
Yeah, do you hear that? We're rooting for you. And I'm glad
Thank
you
you
asked
very
that
much.
too, because even further
Right.
your question, Tara, like, does it matter I've always heard, like, because I do that too, and like what pavement, that either sidewalk as opposed to running on soft asphalt, does it matter?
It does play, just like with athletes, like, you know, we have special tracks for athletic meets. It does matter about the amount of impact.
Right.
So what kind of surface you're running. If you're going to run on long distances, you want to make sure that you have proper footwear. Okay, the footwear that you may necessarily use in the gym may not be the same which you use for running. So as long as you manage the footwear and you stay safe, you know your limits, you're going to be just fine. But I would say keep doing it. Don't stop exercising, don't stop running, keep doing it.
Yeah, just keep modifying and
Yeah.
pay attention to your body when it feels good.
Absolutely, just listen to your body.
All right, thank you so much for your question. And we also have Ann on the line now. Ann, what is your question for the doctor?
My question is this. Good morning to both of you, and thank you for taking my call. I wanted to know if you have a knee replacement, how I'll let you answer that question first.
I think, did you hear that?
No, I
Ann,
did
you
not.
cut out a little bit. Can you repeat your question, please?
Yes, I said if you have a knee replacement, how long does that one replacement last?
That's a great question, and thank you for calling in. Typically, this used to be somewhere in the region of 10 to 15 years. But honestly speaking, the technology has improved so much. Now we expect these things to last 20 to 25 years. When I was a student or a trainee back in Canada, I actually saw some of my professor's patients who he had done 25 years ago, and they just came in to say hello and kind of say thank you. So right now with the technology, we expect around 20 to 25 years out of it.
Okay, well, I had one in 8 years ago, and it continually hurt all the time.
Okay.
Is that normal?
One, I'm sorry to say that it hurts. There are various technical reasons of why that may happen. I'm actually a joint specialist, so I also do a lot of redos, which means when things have not gone well for a variety of reasons at a different place, we look after those patients and find out, okay, what's gone wrong? Is this something which needs to be redone? Or are there other ways we can solve this problem? So to answer your question in a nutshell, if you have pain at 8 years, that's really not the norm. It's a little unfortunate. I would be happy to help you if you would like me to.
I would love to. How can I get in touch with your office?
We will have all the information for you.
You can, yes, and you can you can give her the number right now, and she can write it down, or you can go to ktbs.com. We'll have all the information there after this. You can even watch the replay of this, and we'll have that information, and you can call the office.
Absolutely. Thank you so much. And we try to get in people as soon as we can because we understand this is important to you. Our clinics are usually good at getting people in within a week.
Okay. So I have to go to ktbs.com.
No, you would call my clinic at Bossier Orthopedics. We're part of the Willis Knighton Health system. And sorry, go ahead.
Willis Knighton Health system in Bossier?
Correct.
Yes, Bossier Orthopedics.
Okay, gotcha. All right, thank you so very much. Both of you have a great day.
Thank you.
You're welcome. Thank you so much for calling, and good luck to you. So speaking of the surgery, and are there other non-surgical treatments for joint replacement? You're a joint specialist. I'm sure there's all kinds of other treatments.
So yeah, as I said, they vary from trying non-surgical treatments to joint preservation and joint replacement. Now, non-surgical treatments, trying medication, exercise, weight loss seems to be a big part of this. If you drop 1 pound of weight, the way the physics works is it actually decreases 2 pounds of effective weight on your knee.
Wow.
So if you've dropped 20 pounds, you're going to lose 40 pounds on your knee and give them a big relief. They're going to thank you. Okay. Other options that we use are injections. These can either be steroid injections, these can be lubricant injections. People commonly like to call them as rooster comb injections. But those are options we can also do. There is a kind of an tested treatment called PRP, or platelet-rich plasma, which unfortunately is expensive because it's not usually covered by insurance. But that has also been slightly helpful. We really don't have excellent data on it, but that's something that can be tried as well.
Okay, and tell us a little bit about the injections. How often, how long do they last? Is it just a minor fix for a little while, or does it actually improve the joint?
So the cortisone injection cannot really improve your joint. It helps to buy you time, and these injections can be done up to 3 times a year or at an interval of 4 months typically. We use them when we're trying to bridge a problem and help them, say if they have both knees which are bad. Okay, we're going to fix the right one. We're going to buy them some time on the left one. We can give them a shot on the left one. Or there is something important, other things going on, like they have a heart issue which needs to be tackled first. We need to buy them time. So cortisone injections can help. The other is the lubricant injection, which kind of stimulates the normal fluid in our joint. And that's another option as well. Being expensive, we like to get it approved through insurance, so the patient doesn't get a big expense for it. These are the kind of injections you can use. Anywhere from 4 to 6 months seems to be very safe and reasonable to do.
Well, that's comforting to know too. And that's something like you need both knees, or like you said, you might have something else you need to take care of.
Correct.
Like a heart problem or other contraindications to actually having surgery at all, that you can kind of bide some time and have comfort instead of just having to wait and be in pain until everything gets lined up for surgery.
Yeah. Now sometimes you have very geriatric or very old patients, like say someone in their 90s, who really cannot tolerate a major surgery. So the only option remains is to do injections for them. So they periodically will come every 4 months like clockwork for their injections, and that keeps them going. Sometimes that is the treatment we will do and not offer them an operation. So we try not to be knife happy.
And that's so nice too. If someone does get a certain age, or someone just have a condition where they just cannot have surgery, at least there's something that you can do to alleviate the pain.
Absolutely. Jokingly amongst the medical community, we're all always called glorified carpenters because that's what we do as joint replacement surgeons. But we really affect the whole person. So when somebody comes to me for a joint issue, we have to look at the whole picture. What is their heart doing? Are their kidneys functioning? Is their blood sugar under control? Are they diabetic? Are they taking care of all that? Once all that is resolved, only then is something we can proceed with joint replacement.
And have you seen someone come in who maybe is overweight, and you can tell that's probably the problem, and then once they lose the weight, they don't even need surgery at all? That sometimes that happens. Does that happen?
Very often.
Really?
We get some motivated patients who will come in that their joints hurt, and they've heard that, okay, joint replacement is an option. And we sit down, we have a nice conversation about their options. One of the things I usually recommend is to keep a food diary. Okay? It's so powerful when you write it down. When you write it down, you look at it at the end of the day, oh, I made a mistake here. You can fix it the next day. You drop a bunch of weight, you come back, we look at the x-rays again, and how you feel. Many patients will say, actually, you know what, I think I can hold off. I don't want a joint replacement right away. And that's a big success to us. That feels like we've achieved something.
And that's a really wonderful thing to hear too, because people think that since you're a surgeon, you want to get right to the surgery. But if you can fix something for us and don't have to do the surgery, that's wonderful to you.
So the way to look at it is, yes, I'm a surgeon, I love to operate, that's what I train to do. But I also want to have the best outcome. How do I have the best outcome? By selecting the right person. Right. Okay. If I start operating on every person who walks through my door, one, my wife's going to divorce me, I'll never go home. But that's also not good medicine. You want to make sure that you're selecting the right person, you are taking care of the right patient and offering them the right choice. Horses for courses. Right. Okay. I think we have a Howard on the line now. What is your question for the doctor?
I want to know if y'all have an ankle replacement.
Howard, good afternoon. Yes, we do have ankle replacements. I personally do not perform ankle replacements. I specialize in hip, knee, and shoulder. But my partner, Dr. David Drummond, is an expert in ankle replacement, and he does a fantastic job, and I'm vouching for him on live TV. So I think he'll be able to help you.
All
All
so
right.
they
Well,
can
I
just call you
appreciate
up.
that very much. Yeah.
All right, Howard, thank you for calling. So you can call the office and see what you can do about that with its partner. All right, thank you. And tell us a little bit, do you want to talk about the advanced technology of the joint replacement that you mentioned?
Now you're getting me excited.
Okay, here we go, here we
Yes.
go. Let's talk about this.
So, a lot of guys do joint replacements. We do a bunch of things which are super exciting. We have acquired Robotics, and in the last 2 years, we've been doing robotic joint replacement surgery, okay? Now, what is the benefit of robotics? As an experienced surgeon, I know what I'm doing. I've done this thousands of times, but then there are certain cases which fall outside the normal limits, either because the way their bone is shaped or the way their anatomy is. That's where the chances of error still remain. Like we had a caller who spoke that she's not happy 8 years after her surgery. The robotics helps us identify these particular problems and stop us from making a mistake. These robots are accurate within 0.5 millimeter. So this much.
That much.
Yeah. And 0.5 degree. And we can make minor adjustments and get correction. So the way the robotics works is actually pretty interesting. It's like GPS, like you drive your car. So we have these trackers which we insert where we're going to do the operation. These trackers are connected to like a GPS near the operating table. So they'll map out the knee. They'll make a virtual model of the knee. They'll create a 3-dimensional structure and tell me exactly what I'm doing, where I'm going to cut the bone. Okay, I'm sorry if it sounds a little gory, I apologize.
No, it's good, it's good. We'd like to know exactly what's going on.
But that makes us super accurate. The other thing that we do is called a custom joint replacement. Okay, so I'm sure everybody's heard about 3D printing now. Everything's been 3D printed. So we get an MRI done. That MRI information actually gets shipped nowadays to Canada, and in Montreal they make a 3-dimensional model based on the input I've provided. So I've actually done the surgery before I've done the surgery. On the day of operation, these custom things help me to be super accurate within 0.5 degree or 0.5 millimeter. So the kind of technology that we're offering now is really state of the art, that it helps us be super accurate. Now, what is the benefit? Why do you want your surgeon to be accurate? Well, if I'm accurate, that's going to translate into your recovery, into your results, into the longevity of your prosthesis, of what we are putting in. How long will it last? So all these factors come into play with what we offer now. So that's why you get me excited about this.
Well, I can see why. That's really incredible.
Yeah.
So how long does it take to perform like a knee replacement?
So typically around an hour is the surgery for the joint replacement. Now, for a patient who's had surgery with me, they probably know that they were in for 4 hours. Actually, the surgical time is usually an hour. It's anesthesia, putting drapes on them, cleansing them, waking them up, getting them out. That actually looks like it's 4 hours. The surgical time of actually performing the operation is an hour.
And is that new with the robotics as opposed to before? Did it used to take longer before the robotics, or?
The time probably has not changed.
Okay.
The time, we've remained time neutral either way. It's not made us faster or slower, it's made us more accurate.
More accurate,
yeah.
So it's the
and
precision.
See, again, when I go in to do a surgery, I'm not looking at time. I'm not looking at the clock of how fast or slow I'm going.
Exactly.
I'm looking at doing a good job. One of the jokes that I have with my patients when I see them, they'll ask me, "Doc, how long will it take and how long will the cut be?" And my usual answer is, as long as it takes to do a great job and as long as it needs to do a great job.
There you go. I mean, you can't beat that answer.
Yeah.
That's great. That's
So
whatever
we're
it
not
takes.
in a rush.
Right.
Because what I do if I take 5 extra minutes, it's going to impact that person's life for decades.
Right.
So we want to take our time.
Definitely. And what about recovery time?
So recovery time, again, I'll give a long answer to this question.
Yeah, go ahead.
The recovery time has been cut in half because the way we do surgery has changed, not only in terms of robotics or technology, but how we do it. So if you look at surgeries which were done in the past, For example, a knee replacement, we used to cut the muscle in the front of the knee, which is called the quadriceps muscle. The way I do my surgery is I actually don't place my cut in the muscle. I do my skin cut, I move the whole muscle to one side, do the operation, flip it back into place. The benefit, these patients have absolutely no cutting inside. So they have their own muscle without a stitch placed inside. The recovery gets cut in half. Okay? The same thing in the hip. In the past, hips were done by cutting the entire butt muscle. I'm sure you must have some parents, grandparents who've had a hip surgery done, and they have a 8-inch scar on the side of their butt. That's not how we do it. We do it through the front. When we do it through the front, well, the scar is a lot shorter for cosmesis, but apart from that, we don't cut the muscle, we go between the muscle instead of cutting across it. So these patients basically get up right in the recovery room. The therapist will come to the recovery room. They'll make them get up an hour later after their legs have woken up, and they walk. And our majority of our patients now go home the same day.
The same day?
The same day. And when I was in training, it was not uncommon for these people to stay in the hospital 4 to 7 days.
Yes.
Yeah.
That's what I always heard. That,
yeah. And
did that have to do with cutting the muscle? Is that why it would take so long before when you cut the muscle? Because is that, when you cut the muscle and sew it back together, is the muscle ever the same? Is it still just as strong?
It does recover. At the 1 year mark, they're probably the same. But do you want to wait 1 year after your joint replacement to recover?
Sir.
Right? What has also changed is how anesthesia works with us. We try not to put our patients under. Now, before I say that, you're not actually awake, you're not helping me and telling me, doc, do this.
Okay, phew.
Yeah, we put you in a twilight zone, you're sleepy. We numb your legs like women who are having babies get epidurals. So we numb your hip and your knee. So you can't feel below that, and then we make you sleepy. The benefit of that is it is really safe for your heart, your lungs, and with older patients, dementia, and your brain too. So that really improves their recovery. We also do nerve blocks. So instead of giving them a lot of narcotic medication, these nerve blocks help to decrease the amount of narcotics we give them. As a result of that, our pain management has improved so much that the patients recover a lot faster.
That is incredible. Okay, I want to talk some more about that, but right now we have Jim on the line. Jim, what is your question for the doctor?
Yes, thank you for your program. This might be a little unusual question, but it involves the knee and knee pain. I had COVID, and post-COVID, getting healthy, getting like that, I developed in one of my knees real bad knee pain, and it's still continuing now for probably into 3 weeks. Have you read anything about that? Could have been related to the COVID? And your thoughts? Thank you.
Jim, thank you so much for calling in. Yes, it can certainly be related to COVID. Even before COVID came along, people would get viral illnesses, and sometimes that would cause joint pain. We call that joint arthralgia. Sorry for the technical term, but that's called joint arthralgia, and that usually is a response to a viral infection. Now, COVID is also a virus, so it certainly can cause the same viral arthralgia and cause joint pain. And it can sometimes be painful, it can sometimes persist as well. So you're absolutely right in thinking that this might be COVID related as well. I hope that answers your question, sir.
Does that answer your question?
Yes, what would be the treatment for it?
The treatment, again, I really would need to see someone in person and examine them before I offer any kind of treatment.
But it's good to know that you're right, that it could be COVID related, and that, yeah. So,
absolutely, yeah.
Well, good luck. We hope that everything goes well and you feel better. Thank you so much for calling. We appreciate it. So Doctor, we talked about when we talk about advanced technology, we think about it making better and easier and all these advancements. And one of the things that I think sometimes we lose sight of is the reason for technological advancements is that it's better for the patient. Everything that I heard you say is how much better it is for the patient, not just easier and better and more precise for the doctors.
Absolutely. So why do we pursue these?
Yeah.
Okay, the reason is studies were showing that 4 out of 5 patients were the ones only happy with their knee replacement. That means 80% people. We still had that 20% window who were unhappy with their joint replacement surgery, and we wanted to, get those 20% people happy. The closer we can get to 100%, whether can we ever get to 100%? Yes, I am always hopeful, but I'll take 99. I'll take 98. Anything 98, 99% is pretty good in life. So those 20% people where we were making those mistakes, where I was talking about accuracy, altered anatomy, we're all different. We're big, small, tall, short, we kind of come in all shapes and sizes. And we could not offer a one-stop solution saying, okay, let's go to the OR, let's open your joint and then we'll figure it out. This figure it out was, we wanted to figure it out before and anticipate problems and get good at them. That's where I tend to be very obsessive about. I want to anticipate the problem and not, be stranded there. And that's the desire for technology.
Yes, and just to figure it out ahead of time instead of just looking and be surprised or anything that's going on.
Yeah,
so
I'm like, we don't want an oops moment in the middle of the operation.
Yeah, okay.
Yeah, so fortunately, my wife jokes about it every Saturday evening, or Sunday evening, I should say, sorry. Why are you so serious? I got to prepare my cases for the week. So I lock myself in my office and I'm preparing my cases for the week. I've done this thousands of times, but that's one habit we will always keep, is we don't want surprises.
That's one of the things I love about Healthline 3 and talking to you today too, that it makes it more personal with our doctors. We don't realize that we have your own system and that you do. It's your life's work.
Absolutely.
And you have your own way of preparing and caring about that. So that's your system. You'll do that on a Sunday and look at your week's cases and get ready?
Oh, believe me, when I was a student, my professor used to joke about it, that there'll be times when you'll wake up at 2 a.m. and you'll be doing the surgery in your head if you have a difficult case. He was right.
Yeah.
Happens to me once a week. when I am doing it in my head at 2 a.m., just because it's a difficult surgery, I want to make sure I'm prepared.
That's so nice.
Yeah.
Of course it is.
But, we love what we're doing. This is no better job in the world. I joke about it that I hope Willis Knighton's not listening, but I would do it for free.
Okay.
Yeah. Because the joy we get from these people getting up and doing what they want to do, I mean, really.
Yes. And that's the joy of life in any profession, but especially in your medical. You want someone who would do this for free, who would do it just because they enjoy doing it.
Absolutely.
And you obviously do, and care about the communication, which is so big, communicating with your patients and really seeing where they are, what they need, and how you can help them.
Oh yeah, if tomorrow morning we won the lottery, I'd still come tomorrow morning and do my 6 cases.
Yes, I believe that. I believe that. And that's who you want. That's who I would want, who enjoys what they're doing.
Oh yeah, I mean, with the advent of technology, we have so many tools with us now that it's actually made the surgery super simple, super easy. Because all these problems which, I mean, I can't take credit. My predecessors are the ones who came out with all this technology. And they made my life easier. They made my patients happier.
Well, you've certainly made our day so beautiful and so much easier just listening to this and hearing all things about joint replacement surgery, all of the things that we never really knew was available for us. And before we have a couple of minutes left, I think maybe 1 or 2, but you want to touch briefly on, I know someone called about if you have an unsuccessful or you're not quite happy with yours, what are the options quickly for someone who has that?
We can redo the joint replacement surgery. That's called a revision joint replacement. And that's where you want to really, apart from myself, go to someone who's been doing this, who's done this a lot, because revision joint replacements are complex. You got to figure out if a mistake was made in the past, and that's an instant figuring it out and solving the problem there and then. Okay. All right. So that's what is revisions.
All right. Well, thank you again so much for being here. We really appreciate it.
Well, thank you so much for having me here. This is something I'm very passionate about, and I really enjoy my patients. We try to have a good laugh and do good work in the process.
Well, it's certainly been a pleasure meeting you today. Thank you for being here with us. We appreciate it.
Thank you so much, and thank you for all the callers and the viewers for giving me an opportunity here.
Absolutely. Special thank you for those who called in and all of our viewers. We appreciate you joining us for Healthline 3. Enjoy your afternoon, and we will see you next time.